Welcome. You're probably here because you want to understand something important about your pet's health. Maybe something that's starting to worry you as they get older.
Right. And you want that info quickly, clearly, without wading through tons of technical stuff.
Exactly. That's what this deep dive is all about. Today, we're tackling cognitive dysfunction syndrome, or CDS. It affects aging dogs and cats.
Yeah, it's definitely something many pet owners eventually encounter or worry about.
So, what is it in simple terms?
Well, fundamentally, it's about how a pet's brain changes with age. And these changes, they can impact awareness, responsiveness, learning, memory.
And sometimes their mood, too, like anxiety.
Yes, exactly. Anxiety, maybe some agitation, that can be part of it too.
Okay. We're basing this discussion on some really solid information excerpts from a text specifically on CDS. Our mission here is to pull out the essentials for you.
Yep. Give you a clear overview, what it is, the signs, what we currently understand about the causes, without the heavy jargon.
All right, let's jump in. To really get a handle on this, what exactly is cognitive dysfunction syndrome? Define it for us.
Okay, so it's a syndrome, meaning a collection of signs, and it's linked directly to the aging process in the brain. This leads to noticeable changes.
Changes like,
Changes in their awareness, maybe they seem a bit out of it. They might respond less to things around them, like sounds or people.
less excitement for toys, maybe?
Could be, yeah. And crucially, deficits in learning and memory. Things they knew, they might forget. New things are harder to pick up.
And you mentioned anxiety and agitation can sometimes be part of that picture, too.
That's right. It's not just cognitive. It can be emotional or behavioral, too.
And I read that the early stages, sometimes just called cognitive decline, can be really subtle, like easy to miss.
That's a very good point. The first signs are often quite slight. You might notice, say, a change in their normal activity level.
Less playful.
Yeah, maybe less interested in play or walks seem less exciting.
Yeah.
Or maybe a cat who loved batting toys around doesn't anymore. It could also look like an increase in general anxiety.
Like noises bother them more.
Exactly. Things that never fazed them before might suddenly make them jumpy or worried.
Yeah.
It's easy to just think, oh, they're just getting old, but it could be an early sign of CDS.
Okay, so we know it's happening in the brain. What's physically going on in there? What are the underlying mechanisms?
Right, the pathophysiology. This is still an area of active research, truth be told. The exact link between the brain changes and the signs we see isn't perfectly mapped out yet.
But we know some things are changing.
Oh, definitely. We observe physical changes. There's often a decline in the actual number of neurons' brain cells. The frontal lobe, important for thinking and decisions, can shrink a bit.
Shrink. Wow.
Yeah, reduce volume. And the ventricles, those fluid-filled spaces in the brain, they can get larger. Plus, we see a buildup of, let's call them neurotoxic deposits.
Toxic stuff building up, like what?
Things like lipofuscin and ubiquitin, they're sort of like cellular waste products that accumulate over time and can gum up the works. And then there's beta amyloid.
Beta amyloid. I feel like I've heard that mentioned with Alzheimer's in people. Is it similar here?
There are definitely parallels being drawn. The source suggests a possible link between this beta amyloid accumulation, it's a sticky protein in the cerebral cortex, and cognitive decline in pets.
So it interferes with brain cells.
That's the idea, yeah.
Uh,
And another big factor seems to be toxic free radicals or reactive oxygen species. These damaged cells,
and they increase with age.
they tend to, yes. Due to various things like chronic illness, stress, mitochondria, the cell's powerhouse is getting less efficient, and the body just not clearing these damaging molecules out as well as it used to.
So more damage happening and less cleanup crew available.
That's a good way to put it. So the source points to this possible connection between cognitive decline and both beta amyloid buildup and increased free radicals.
Okay, what else contributes?
Well, blood flow to the brain seems to be involved too. Compromised cerebral blood flow, less oxygen, fewer nutrients getting where they need to go.
That can't be good.
No, and maybe even tiny strokes, called infarcts, could play a role. Finally, the communication between brain cells gets disrupted. Neurotransmission.
The chemical signals.
Exactly. There might be a drop in key neurotransmitters like catecholamines and acetylcholine. This communication breakdown adds to the cognitive problems.
Wow, so it's a combination of things, cell loss, toxic buildup, maybe poor blood flow, and communication issues. That sounds complex.
It is. It highlights why just one single treatment might not be the whole answer.
Okay, so who gets this? Is it just very old pets, or?
It definitely becomes more common with age, but it's not just the extremely old. The stats are quite sobering, really.
Give us some numbers.
Okay, so for dogs over 14 years old, something like 41% show clinical signs. Even for dogs over 10, it's around 14%.
14% over 10, that's quite a few.
It is. And for cats, it's similar, maybe even a bit higher in the oldest group. Around 50% of cats over 15 might show signs, and about 35% of those over 10.
Half of cats over 15, wow.
Yeah, and a really important point the source makes is that it's progressive. If a pet starts showing one or two signs, they're likely to develop more over time.
And it hits both dogs and cats?
Yet both species are affected. It's not just a dog thing or a cat thing.
You mentioned clinical signs, but can it start even earlier, before owners notice?
That's a fascinating point. Apparently, yes. Specialized neuropsychological tests, not something your average vet clinic does. Mind you, you can pick up subtle declines in memory and learning as early as 6 to 8 years old in some animals.
6 to 8, that young.
Yeah, but the owners might not see anything they'd call a problem for years after that,
Hmm.
especially if it's just, a regular family pet.
But maybe if the dog has a specific job.
Exactly. Owners of highly trained dogs, like service animals, or dogs doing agility or obedience, they might spot those tiny changes much earlier because they rely on very precise responses. A slight hesitation or miscue might stand out to them.
That makes total sense. Okay, so for the rest of us, with our beloved, maybe less highly trained companions, how do we spot the signs? What should we be looking for?
Well, the source gives us a really handy acronym to remember the main categories of signs. It's DISH, D-I-S-H.
DISH. Okay, let's break that down. What's the D?
D is for disorientation. This is probably one of the classic signs people think of.
Like getting lost.
Yeah, getting lost or seeming confused in familiar places, your own house, the garden, maybe struggling with familiar routes like going to the hinge side of the door instead of the opening side.
Oh, I've heard of that. Or getting stuck in corners.
That's another common example, yes.
Mhm.
Just seeming generally mixed up about where they are, how to navigate.
Okay, so disorientation. Got it. What about I?
I stands for interactions, specifically changes in social interactions, how they relate to people or other pets in the house.
So what might that look like?
It can go a couple of ways. Some pets become more irritable, maybe grumpier. They might show less interest in things they used to enjoy, like being petted or playing.
So more withdrawn?
Sometimes, yes. But interestingly, it can also go the other way. Some pets become more clingy, seeking constant attention, almost demanding it, in a way that's different from their usual personality.
Huh. So any significant shift in their normal social behavior, basically.
Exactly. A change from their baseline.
Okay. D is disorientation. I is interactions. What's S?
S is for sleep-wake cycle alterations. Big changes in their sleeping patterns.
Like being awake all night.
That's a common one, yes.
Mm.
Night waking, maybe pacing around, even vocalizing whining or meowing when they should be asleep. And then the flip side is often sleeping much more during the day than they used to.
So their internal clock is off?
Sort of, yeah.
Yeah.
Sometimes it's called temporal disorientation.
Right.
Their day-night rhythm gets messed up.
Okay, that's definitely something noticeable. Next is H.
H is for house training lapses or issues with other learned habits.
Yeah.
This one can be really upsetting for owners.
You mean having accidents indoors?
Yes. A dog or cat that's been reliably house-trained for years might start having accidents inside, forgetting where they're supposed to go or maybe losing the signaling behavior they used to use.
Right, that would be worrying. Okay, so D-I-S-H, what's the final A?
A is for activity alterations, changes in their general level of activity and engagement with the world.
So, like we mentioned earlier, maybe less interest in walks or play.
Yes, initially it often presents as a decline. Less exploration, maybe less self-grooming, sometimes even eating less. Just a general decrease in get up and go.
But you said sometimes it can increase later.
Paradoxically, yes.
Hmm.
In some later stages, you might see an increase in certain activities, but they're often purposeless. Things like restlessness, aimless pacing back and forth, wandering without seeming to go anywhere specific.
Compulsive things, too.
Yes. Compulsive behaviors like excessive licking of a spot or maybe tail chasing can sometimes develop or worsen.
Mhm.
And we should also lump increased anxiety and agitation under this. A, they definitely affect overall activity and behavior.
Got it. So, DISH, disorientation, interactions, sleep-wake, house training habits, and activity. That's a really helpful framework.
It is. It covers the main areas owners might observe changes in.
But, some of these sound like things that could just be old age or maybe something else entirely. How do we know it's CDS and not another medical issue?
That is such a critical point, and the source emphasizes this heavily. Before you land on a CDS diagnosis, you absolutely must rule out other medical conditions that could cause similar signs.
Like what, for example?
Well, think about pain. Chronic pain from arthritis, which is super common in older pets, or dental disease. Pain can make pets irritable, anxious, reluctant to move or be touched.
Which could look like interaction changes or activity changes.
Exactly. If it hurts to get up, they might have accidents inside because they can't make it to the door fast enough. That looks like a house training issue.
Okay, so pain is a big one to check for. What else?
Sensory decline, losing vision or hearing. That can obviously cause confusion, disorientation, maybe make them seem less responsive or more easily startled.
Right, if they can't see or hear well.
Urinary tract infections or other urinary issues can cause house soiling. Kidney disease, liver problems, other organ failures can all affect mental state and behavior.
Tumors, too.
Absolutely. Brain tumors or even tumors elsewhere that cause pain or metabolic changes. Immune diseases and endocrine disorders are really important mimics.
Endocrine, like thyroid problems.
Precisely. Hypothyroidism, low thyroid in dogs, can cause lethargy, mental dullness, sometimes even aggression. Hyperadrenocorticism, or Cushing's disease, can cause restlessness, panting, sleep changes.
And in cats.
In cats, hyperthyroidism, overactive thyroid, is common and can cause agitation, hyperactivity, vocalization, weight loss despite a good appetite, all things that could overlap with CDS signs.
Wow. Okay, so the message is, if you see these Dysha signs, step one is a thorough vet checkup to look for other causes.
Absolutely. Blood work, urine tests, physical exam, maybe imaging. You need to rule out these other treatable conditions first.
Okay, so let's say other things have been ruled out and CDS seems likely. What can actually be done? Is there a cure?
Yeah, that's the big question. Unfortunately, as we understand it now, there isn't a cure for CDS. And like we said, it tends to be progressive.
So the signs usually get worse over time?
Generally, yes. And this is there's a lot that can be done. The goal of treatment and management is really to slow down that progression and, very importantly, improve the pet's quality of life.
Okay, so managing it, not curing it.
Exactly. And the source really stresses that it usually requires a lifelong, kind of multi-pronged approach. There's no single magic bullet.
A multifaceted strategy. Makes sense given how complex the underlying changes seem to be.
Right. It's about supporting the brain and body in multiple ways to buffer those age-related changes.
So what are the key parts of this strategy?
Well, first off, lifestyle adjustments are huge. Seems simple, but it's vital.
Like keeping them active.
Yes. Maintaining a routine with appropriate exercise and pass to their age and health, of course. Engaging play sessions, continuing training activities, even simple ones.
Mental stimulation, too.
Definitely. Puzzle toys, learning new simple tricks, keeping their minds engaged, and sticking to a predictable daily routine can also be really helpful for reducing anxiety and confusion.
So keep their minds and bodies active and keep their world predictable.
That's a great summary of the lifestyle part, yes. Think of it like use it or lose it, but gently.
Okay. What about diet? Does food play a role?
A really significant role, according to the research cited. There are actually prescription diets specifically formulated to support cognitive function in aging pets.
Oh, really? Like what's in them?
The source mentions a couple. Hill's Prescription Diet BD is one. It's got things like antioxidants, omega-3 fatty acids, carnitine, alpha-lipoic acid, nutrients thought to help mitochondria work better and fight oxidative damage in the brain.
So protecting the brain cells.
That's the idea. Another one mentioned is Purina Pro Plan Bright Mind 7 Plus Ni. That one includes medium-chain triglycerides, or MCTs.
MCTs, what do they do?
They provide an alternative fuel source for brain cells. Apparently, aging brains sometimes struggle to use glucose, their normal fuel, efficiently. MCTs offer an easier-to-use energy source.
Interesting. So these aren't just standard senior foods. They have specific brain support ingredients.
Correct. They're therapeutically designed.
And what about supplements? Are there specific nutrients people can add?
Yes. Besides the diets, certain nutraceuticals have shown some evidence of benefit. For dogs, the text mentions phosphatidylserine.
That's a mouthful.
It is. Also, apoecrine, which comes from jellyfly, believe it or not, and same S-adenosilmethionine.
Okay. Any brand names mentioned for those?
It notes Senalife and Activate often contain phosphatidylserine, Nutrix contains apoecrine, and Novafit is the same product, but there are others too.
And for cats?
For cats, Sam's has also shown some promise. And there was a study mentioned using a specific combo of fish oil, arginine, and antioxidants. But that exact formulation isn't commercially available as one product right now.
Right. So lots of options, but definitely something to discuss with the vet first.
Absolutely crucial. Don't just start adding things. Diet and supplements need to be tailored to the individual pet and their overall health.
Okay, diet, supplements, lifestyle. What about actual medications? Are there drugs for CDS?
There are, primarily for dogs though. The main one licensed in North America is selegiline.
Selegiline, how does that work?
It's an MAO-B inhibitor, a monoamine oxidase B inhibitor. Basically, it's thought to help increase levels of certain neurotransmitters like dopamine, which can decline with age. This might improve brain cell communication.
So helping those signals get through better.
Potentially, yes. It might also have some effects on reducing free radicals and protecting neurons. The text gives typical dosages.
Are there side effects?
There can be, yes. Things like GI upset, restlessness, sometimes repetitive behaviors at higher doses, and really importantly, it has significant interactions with other drugs.
Like what?
Things of other MAO inhibitors, certain painkillers, narcotics, some antidepressants like SSRIs and tricyclics and alpha-adrenergic agents. So the vet must know every single thing the pet is taking.
Okay, so careful management is key if selegiline is used. Are there other drug options?
The source mentions a couple more, though they might not be licensed everywhere for this use. Propentophyline is used in some countries.
What does that do?
It's thought to improve blood flow, maybe make red blood cells more flexible, potentially increasing oxygen delivery to the brain without increasing its energy demands too much.
Better circulation.
That's the hypothesis. And another one is nisergaline, an alpha-adrenergic antagonist, also thought to potentially improve cerebral circulation. It's used in dogs and sometimes off-label in cats.
Off-label in cats. So are there any licensed drugs for CDS specifically in cats?
No, unfortunately not at the time this source was written, but vets do sometimes use selegiline, propentophyline, or nisergaline off-label for cats based on anecdotal reports and some small studies.
I see. So fewer proven drug options for cats currently.
It seems to be the case, yes.
Are there any other, maybe more alternative medications or approaches being explored?
The text briefly touches on a few other things. Drugs like adrephenel and modafinil that promote alertness. Anti-inflammatories are sometimes considered.
Natural supplements.
Yeah, things like ginkgo biloba and curcumin get a mention. Also, drugs used for Alzheimer's in humans that boost acetylcholine are mentioned, but with a big caveat that doses and effects in pets aren't well established and side effects can be an issue.
So more experimental at this stage.
Seems like it. And then, importantly, there are medications to manage specific symptoms of CDS, like anxiety or sleep problems.
Ah, okay. So not treating the CDS itself, but the related issues.
Exactly. Anxiolytics like buspirone, maybe benzodiazepine short-term, or certain antidepressants could be used for anxiety or apathy. Again, being mindful of that interaction risk with selegiline.
Right. And sleep aids.
Yes. Things to help with that sleep-wake cycle disruption.
Yeah.
There are natural options here, too, that some find helpful: melatonin, valerian, L-theanine, alpha-casozepine.
I've heard of some of those.
Yeah, and also pheromone products like Adaptil for dogs or Feel-Away for cats can sometimes help with anxiety. Products like Harmonies are also mentioned.
It really sounds like building a treatment plan is very personalized.
Absolutely. It's about finding the right combination of lifestyle, diet, supplements, and maybe targeted medications for that specific pet signs and overall health, always working closely with the veterinarian.
Okay. So as we wrap up this part, what are the absolute must-remember points for pet owners dealing with suspected or diagnosed CDS?
Okay, key things. 1, report any changes in your older pet's health or behavior to your vet. Don't just dismiss it as old age.
Be proactive.
Yes. 2, understand that CDS is generally progressive, and treatment aims to slow it down and manage signs, not cure it. Manage expectations.
Right.
3, regular vet follow-ups are essential. Treatment isn't static. It needs monitoring and adjusting.
Keep checking in.
Definitely. 4, early intervention gives the best chance of slowing things down. The sooner you start management strategies, the better.
Don't wait until it's really bad.
Precisely. And finally, while diet, supplements, and medications can often help control signs and improve quality of life, be prepared that age-related decline and other health issues will likely still be part of the picture eventually.
Okay, that's a realistic but hopeful perspective. So let's try and pull this all together. What are the main takeaways from our deep dive today?
I'd say the biggest takeaways are CDS is real, it's common in older pets, and it shows up as a mix of cognitive and behavioral changes summarized by Disha.
Disorientation, interactions, sleep-wake, house training, activity.
Exactly. Recognizing those signs early is key. Then, ruling out other medical causes is critical.
Get that vet check.
Yep. And then management is multifaceted lifestyle changes, specific diets, targeted supplements, and sometimes medications like Saligelin all working together.
The goal being to slow progression and maintain quality of life.
Precisely. While we're still figuring out all the exact causes, the focus now is on supporting brain health and function through these combined strategies. And consistent veterinary care is non-negotiable.
It certainly sounds like managing CDS requires commitment, but can make a real difference for our senior pets. Which brings us to a final thought.
Yeah.
Well, our pets are living longer than ever, right? Which is wonderful, but it also means we're seeing more age-related conditions like CDS. So here's something for you, the listener, to think about. How do you think our understanding and treatment of cognitive decline in pets might change in the future?
Interesting question.
Could we see breakthroughs similar to those in human Alzheimer's research? Will new therapies emerge? And what can we learn just by carefully observing our own aging companions? What insights might that give us into this complex process?
It's definitely food for thought. The human-animal bond means we're more invested than ever in their well-being into old age.
Exactly. It's something worth pondering as we care for these cherished members of our families through their golden years.